sir. I'm a surgeon, a very good one.
So is my grandson, so why don't you take your hands off
Wait,
me?
he's your grandfather?
I'm serious. I can handle this till he gets here.
No, because you're not allowed to treat family members, and he has mid-epigastric tenderness and GERD. It could be ascending cholangitis.
Ascending cholangitis? Really? With only one of the symptoms of Charcot's triad?
So what are the other two signs that Dr. Yang missed and made her misdiagnose Dr. Avery in front of Dr. Avery? Charcot's triad is a medical classic and a key sign of ascending cholangitis, a life-threatening bacterial infection of the bile ducts. The triad consists of three main signs. Dr. Yang got only one, which is the right upper quadrant abdominal pain, which is caused by the distension of the bile ducts. However, she missed two other main signs, which are fever and chills due to a systemic inflammatory response to the infection, and she also missed the jaundice, yellowing of the skin and the eyes due to the bile backup. While this triad is highly suggestive of cholangitis, it's not always present. For more severe cases, two additional signs are added to form the Raynaud's pentad. We are going to add mental confusion and hypotension. Hypotension is caused by the septic shock, indicating a medical emergency. So, ascending cholangitis is caused by bacterial infection in the biliary tract. This infection almost always occurs because of an obstruction, most commonly a gallstone, which blocks the flow of the bile. The stagnant bile allows bacteria to travel upward from the small intestine, leading to a dangerous combination of infection and obstruction. Diagnosing cholangitis is an emergency and requires a combination of clinical assessment, lab tests, and imaging. For the clinical evaluation, we suspect cholangitis if a patient presents with any part of Charcot's triad, especially if they have history of gallstones. Second, lab tests. We have two main signs to check: signs of infection with high white blood cells count and elevated CRP, which is going to confirm the infection. The second is signs of cholestasis, which is going to be confirmed by elevated bilirubin, especially conjugated bilirubin, and liver enzymes, which are alkaline phosphatase and gamma GT, which indicate bile flow is blocked. Third and most important, imaging. The main goal is to confirm the diagnosis and to find the cause of the obstruction. An abdominal ultrasound is usually the first choice, as it can show dilated bile ducts and it also can detect gallstones. Other tests like CT scan or MRCP, they can also be used for more detailed evaluation. Now for the treatment. The treatment involves immediate antibiotics and quickly relieving the obstruction to prevent life-threatening complications.